I'm Dr. Leonard Kaplan. I'm the owner and founder of OWM Integrative Wellness. Started the practice in 2014, and the main goal of the practice is to provide the most cutting-edge advanced natural treatments to optimize people's health and wellness. So PRP is very interesting in the way it works. It's a pretty complex mechanism. When PRP is injected into an area of injury, the platelets do something that's called a degranulation. They break up and they release these growth factors. So the growth factors immediately go to work in starting the repair process. But there's also more than that. They actually contain signaling agents. And those signaling agents then go out to where we make stem cells. So for instance, like a bone marrow and their fat, and they recruit those stem cells to then follow them back to the site of injury, which is pretty amazing. Okay, the other thing that they do is platelets form clots. So everybody knows that we need platelets to control bleeding. So when we inject platelets into an area of injury, let's say like a torn tendon, it creates like this clot that becomes like a landing platform for these stem cells, because stem cells need something to come into and land and attach to. So it's almost like three different actions rolled into one. So it's a pretty amazing thing that's happening. And of course, it's happening naturally when we hurt ourselves, but here it's concentrated and much more focused. PRP is by far one of the best treatments going for any kind of musculoskeletal injury. What we do is we practice a very comprehensive approach to treatment of any injury. And we use a traditional prolotherapy treatment approach called Hackett and Hamwell method. And this method recognizes that not only is there a required attention to an injured part of the body, but the whole area around the injury has to be accounted for. Because what commonly happens is the infrastructure of the injured area, let's say a knee, right, starts to break down before some kind of an injury happens. So things will loosen. So ligaments will start to loosen. Attachment of tendons will loosen. And if you only treat the area where the problem is, so for instance, if you go in and say, I have an arthritic knee and I'm going to inject PRP just into the joint, you've just left 75% of the problem on the table. Because before that knee became arthritic, all those ligaments and all those tendons have become loose and the knees become wobbly, right? And you got to address that, because that's in the way as the root cause of the problem. So here, the difference is that we, with PRP, treat all of these infrastructure kind of important points, right? So there's a concept called Tensegrity, which means tension integrity. So these structures, ligaments and tendons, provide tension that holds the joint in balance. When they're disrupted, the integrity is disrupted. We restore that integrity. That is not done in the majority of the places that do regenerative medicine, including PRP.